about the only time in your life you can put on 30 pounds and not feel guilty at all. But a lot of women do not see pregnancy that way. Studies show, in fact, that 20% of pregnant women do not gain enough weight during their pregnancy, and many of those suffer from a condition known as pregorexia, something that can be downright dangerous to your baby and that many feel is inspired by these super slim celebrity pregnant bellies. Dr. Jake Deutsch joins me now with more on this. Doctor, good morning to you.
Good morning, Megan. How are you?
All right, so I'm doing great, thanks.
Good
you know, they say, they just revised the guidelines to say, what should a normal-sized pregnant woman gain in her 9 months of pregnancy?
25 to 35 pounds. So that's what's in the range of normal. But you have to consider that this is going to be gained differently over the course of the pregnancy. We divide pregnancy into trimesters, so they typically recommend about 5 pounds in the first trimester and then 1 to 2 pounds per week in each of the second and third trimester. So a total around 30 pounds, you're right.
But a lot of women now apparently are not doing that because they're obsessed with staying thin, something which is quite literally impossible when you have a baby growing inside of you. And they are using diet, laxatives, excessive exercise, and self-induced vomiting to stop themselves from gaining weight?
Yep, all of those things are true, and it's like you said, it's an obsession, it's a cultural phenomenon, and it's really a serious problem, Megan, because we're talking about fetal mortality as an outcome. We're talking about permanent problems like spina bifida and cerebral palsy, and even more chronic problems. They're seeing higher incidence such as asthma, ear infections, upper respiratory tract infections. So this is something to be serious about. And when you even think about it as starving a fetus, I mean, that's essentially what people are doing when you're not eating enough when you're pregnant. It's just downright inhumane. So it has to be addressed and it has to be taken very seriously.
Well, I know. I mean, you mentioned some of the problems that can arise, and I was looking myself. They say low birth weight, prematurity, higher miscarriage rates, metabolic abnormalities in your baby, growth retardation, birth defects, and it goes on and on. I mean, it really does seem like the most selfish thing you can do.
It is,
because you're not only starving yourself but your child. But Dr. Deutsch, what is the dangerous level? Because now they're saying that if you're obese to start with on your pregnancy, then you should gain very little. So how do people know what's dangerous and what's not?
Well, first of all, you should be consulting your doctor while you're pregnant and be monitoring your weight gains. But when you are heavier, obviously you're not recommended to gain more weight. But the problem is people who are already underweight, who are already challenged with the problem of anorexia, they're expected to gain more. So that may be even a more vicious cycle, a more difficult thing to overcome. So you have to follow the guidelines, like I had said, of about 30 pounds. That's basically about 50 extra calories a day in the first part of pregnancy, another 300 calories in the second part, and an extra 400 to 500 calories in the third part of pregnancy. So those are the rough guidelines that you should be following.
You know, and women should know that even if they go over that, Jenny McCarthy, whose book Belly Laughs, which is hysterical for anybody who wants to read about pregnancy, she talked about gaining almost 90 pounds during her pregnancy. 90. And now look at her. This is her while she was pregnant. Now look at the after. Girlfriend lost it all.
But
she looks damn good.
That's what everybody's obsessed with, is not only being slim during pregnant, but immediately being able to take off that weight. And that's why it becomes so dangerous. I mean, if you're thinking about constantly what clothes you can wear when you're pregnant, fooling people that you don't look pregnant, how you're going to get thin after pregnant, you may actually be suffering from a form of this pregorexia. It's something that everybody should be considering.
I have to say, it is bizarre. Being pregnant myself, I can say, you know, you look down at your body and it just keeps getting bigger and bigger, and you know, and it's only going to get bigger before the baby comes. And I was talking to my doctor about it, and she said every pregnant woman goes through that. You know, you just have to surrender yourself to the process. You're going to get big, and you have to embrace it and try to love it. But the problem is, Dr. Deutsch, we see a lot of these celebrities, not so much Jenny, who gained 90 pounds, but like Nicole Richie, who, you know, they never got the huge baby bumper, so it seemed, and women think, oh, I can't either.
Right, and it used to be beautiful to be on the cover of a magazine while you were pregnant and posing nude. Now it's about being on the cover of a magazine and not looking pregnant, and everybody's speculating, are you or are you not? We've really lost some sort of focus on what's important about being pregnant, and it has to definitely be something that everybody sees their doctors and maintains very closely.
Yeah, it's a beautiful little baby bump. And lest I be accused of contributing to any of this,
you look great.
I will now show off my baby bump on national television.
Go for it.
And let me tell you, I'm proud of it. There's my little buddy. Ladies, get on board. Show off the bump. Here we are in our 6th month.
Good for you, Megan.
Dr. Deutsch, thank you so much for coming on, and we appreciate it. And don't forget, eat. You got to eat, as Nana would say, Bill.
Yeah.
Eat.
Are we discussing names
I used to go
yet?
visit Nana and Pop-Up.
Yeah.
I used to visit Nana and Pop-Up, and the first thing Pop-Up would say we got there, he's Italian.
Eat, Papa.
Get him something to eat.